The pandemic has raised awareness about using donated plasma to treat coronavirus patients. But for hundreds of thousands of people who rely on regular plasma infusions to survive, there are concerns about a looming shortage. Asha Qureshi reports.
My pain levels increase tenfold, maybe even more.
Mother, wife, and rare disease advocate Deborah Vick lives with myasthenia gravis, a neuromuscular disorder that disrupts nerve-to-muscle communication.
The messages are no longer being able to reach my muscles to make them work, whether that is to walk or move or swallow or breathe. It's all interconnected.
There is no cure, so every 2 weeks she requires plasma infusions.
Being in crisis is the worst time to have to wait for treatment. I know for me, my treatments are every 2 weeks, and days before my treatment starts, my breathing has become extremely labored.
Many types of primary immunodeficiency disorders like Vicks result in an inability to produce antibodies to fight off infection.
There's about 250,000 of us in the United States alone.
John Boyle is the president and CEO of the Immune Deficiency Foundation. Canceled drives and fear of COVID exposure, he says, have contributed to a drop in plasma donations for non-COVID therapy. This while the Red Cross says hospital distributions of convalescent plasma have increased 250% in November compared to September.
To not meet the rising demand is one thing, but to actually have less plasma is potentially very, very, very problematic.
Experts say it takes 7 to 12 months to turn around plasma for patient infusion therapies. We are now 9 months into the pandemic, and a crisis, say some, could be around the corner.
Yes, there is a growing concern about the ability to meet patient clinical need.
Amy Infantis is the president and CEO of the Plasma Protein Therapeutics Association. She says while the call for convalescent plasma therapies for COVID-19 has raised awareness, there is still an increased need for plasma for other rare disease patients.
Our companies are making therapies every day for patients who have a perpetual need for plasma, and that is ongoing regardless of a pandemic.
For those who rely on plasma donation and infusion treatment, it could be the difference between life and death.
The biggest fear is not having the treatments that keep me alive. I mean, reality is I don't know what kind of life I will have, if any. How will I function without my infusions?
It's why so many are hoping those who can will give. I'm Asha Qureshi reporting.